Hello everybody, this is a video that's going to be a part of the video series about what sets us apart or what makes us unique here at the Forge Chiropractic. This particular video is going to detail what I call the seated scan. It's just the way that I found to be the most effective on how I find restrictions in the body. So if you come in with a complaint here, I'll still check your whole spine and we'll kind of discuss what we found throughout the exam. So the way it starts is the patient sits right at the end of my table. I sit behind them and I start with 6 points along the pelvis. So I start with a point that's called the PSIS. It's just the bony part on the back side of your hips. After I check that, I move down to what's called the PIIS. Basically, it's the same bony part, the extra eyes, just because it's inferior. Now, I like to move straight across to the other side, find that same spot, and check those same 2 points again. Now, if one of them was stuck, then I can always dip you to the side. So let's say the right side was stuck. I would dip her to the side, push it again. After I check those spots, I move to the sacral base. So basically I take those 2 bony spots again, meet in the middle, and drop down a little bit. So I make a fist and set it right at that spot right there. Then I get nice and close, tell her to lean back and relax. And after I feel like she's relaxed, I give that a little push as well. Next, I move down and at about a 45-degree angle to what's called the sacral apex. So then she slouches, what's basically referred to as normal posture these days, and give that a little push. Next, she sits back up and relaxes. I take that same fist and I'm going to work my way up the spine. And so the way I do that is I create just a gentle rocking motion all the way up the spine. The point of this is just to really highlight if there's a large chunk of spine that isn't moving. So this isn't telling me exact spots right now. This is just telling me, in a general sense, this spot of her back, not really moving. The right hip, and side joint, not really moving. So I need to check those spots 2 or 3 different times in ways to figure out what exactly about that spot isn't moving. So after I work my way up, all the way to the base of her neck, I come back down a little bit between her shoulder blades. And since it's usually just such a problem area for people, it's always worth double checking. And we work our way back up again until we get to her neck. After we get to her neck, I just change my hand placement a little bit, work her way up, all the way up until I get to the very tippy top part of her neck. Then from there, I have her look one direction or another. So for the purpose of this video, I have her look away. Get the ponytail out of the way. And I just keep my fingers there and push along to see if there's any spot that might be stuck. Then also staying on the same side, dip her head to see if it moves in a different direction. After that, to check the very tippy top part, which there's a spot right behind the ear that I like to check. I place a finger there, dip her head all the way down, and look away. And so what that's doing, that's just checking to see if the very top vertebra is moving on the head and vice versa. If I feel like she needs it, I can always check the first rib while I'm here. It's just a spot that, if it's on me, it's basically right there. So you got the trap just in front of the trap. It's in areas where if people hold a lot of stress or they have a desk job, it's often overlooked. So it's just something we can check really quick. To do that, I just dip her head to the side and I feel if that rib ever so slightly moves. And on her it does. So that just highlights the seated scan. There's lots of different things that we can do while we're here. For the purpose of this video, we're not going to include them. If you have any questions about any different things that we might do while we're here, please feel free to leave a comment, or even better, come on in, we can show you. So we're going to move on to the next video, which should be a difference in style and how I might adjust the actual neck. So once again, if you have any questions, feel free to leave a comment. Thanks, everybody.